Research has found that more than 200 chemicals are found in newborn umbilical cord blood. And with the recent toxic spills around the country, we simply can't avoid the fact that we're living in a toxic world. So, what can we do to stay healthy as we navigate this toxic world? Today's guest is an award-winning physician and leader in the field of integrative medicine and environmental medicine. His clinic, the Morrison Center, attracts patients from around the world, many with different illnesses due to toxic exposure. This is the story of Cleanse Your Body, Clear Your Mind with Dr. Jeffrey Morrison. Dr. Morrison, great to have you on.
Thank you, Casper, for having me. It's always a pleasure.
We've known each other for quite a while here, right? It's been many years since I remember meeting you in a seminar room in New York City, and you getting into a conference about biological medicine and everything. And so much has happened since then. But tell me, what are you seeing in patients today that's different from when we met so long ago?
Well, I think it's first worth mentioning that seminar happened to be put on by your father.
It was, yes. That's
Dr.
why I was there.
And he's one of my mentors who's brilliant. And I feel so fortunate to have had the opportunity to learn from him. So nonetheless, I've been fortunate to have been brought up in an environmental clinic. That's where I started my practice right out of family practice residency. I was fortunate in Mechanicsburg, Pennsylvania. There was an environmental medicine doctor who was a part of the American Academy of Environmental Medicine, which is the group that teaches the integrative medicine approach to environmental toxins. So this is a lot different than occupational medicine, which is basically looking for acute poisoning. What we're talking about is chronic low-level exposure that builds up over time, which can be easily undetected, but yet symptoms start to arise that can be quite confusing unless a patient or a practitioner is aware of this and knows what to look for.
Yeah, it's really important that we start to look at what we're actually accumulating within the body rather than that kind of acute understanding of something that quickly gets you, because our bodies have this ability to deal with it up to a point. And then we start to see symptoms. And as I mentioned in the intro, we're living in a very toxic world. It's always been somewhat, but it seems it's more and more toxic. Have you seen that yourself in the practice with patients, that within the last few years, you're seeing people with heavier toxic burdens?
There's no question that in our practice, we are seeing patients that are more difficult to get well with what we had been doing in the past. It just seems that there are many more entry points of whether it's toxic exposure, but I'll also include infection burden, and stresses, and all of these things add up to have a major impact in the body's own natural detoxification capacity.
And, we talk a lot about European biological medicine. My father brings up the barrel, mode, basically, which is we all come with different size barrel. Those are our genetic predispositions, and toxins accumulate in those barrels. Hopefully you have a little spigot, which are your organs of elimination, that could get some of those out. But if you accumulate too many without bringing them out, it overflows, and then we see symptoms in chronic disease. Now, I feel like we've established it's very toxic out there, but from what you're seeing, are there things that are more detrimental that you're seeing more of as far as toxicity goes, whether that's heavy metals, glyphosate? Is there something that's sticking out, or is it just a massive conglomerate in that barrel?
Well, the reason that we're using that analogy of the barrel is because it basically is the image of an all-inclusive vessel from which all these different toxic inputs are basically filling up. And just as you suggested, there hopefully is within our body the capacity to be able to process and eliminate these toxins through the liver and the kidneys and digestive tract through its normal processes. But definitely, maybe it's the last 3 years, call me crazy, but definitely there's been something that's changed that not just me, but also the other practitioners within this office and my other colleagues, we've all acknowledged that something seems different. And When it's worth at least mentioning for people that are listening to this podcast, just to remind everybody what our normal detoxification organs are. So, yeah, our cells literally our cells themselves have the ability to detoxify, every single one. And that's through like the intracellular antioxidants. And everybody knows about the magic of glutathione, but there's other ones like catalase and superoxide dismutase that all help to kind of like bind onto and deactivate toxins to clear it out of the cell. But we also have to remember the cell membrane is also like the cell's detox organ, and also the organ with which it brings nutrients in. So if cells are not getting oxygen properly or being able to remove toxins, the cells themselves become sick. And at the very cellular level, things start breaking down. And then also remember, there's the whole lymphatic system, which is our internal sewage system, which basically puts toxins into the circulation so that it can go to the liver, where it's processed through phase 1, and then phase 2, detoxification. Then phase 3 is through the digestive tract. Hopefully a person's having a regular bowel movement, which helps as our exhaust system to move that all out. And then the kidneys are kind of like the secondary pathway. So people that are constipated, they might end up feeling like they have to urinate all the time because toxins have to go through the kidneys. And if the kidneys are backed up too, then the next place is the skin, which is where people can start noticing like very resistant rashes or psoriasis. The signs of toxicity are what people are starting to recognize, which very fundamentally, it could be chronic skin rashes or hives, like histamine reactions. But also it's like the very symptom of fatigue is a very simple way of measuring toxicity, because going back to where we started, if the cell is not able to get toxins out and get nutrients in, then the cell is not able to make energy properly. The mitochondria get poisoned, and that's where we don't make ATP. Like that's why everybody's trying so many things to try to stimulate mitochondrial function. And fatigue, like exhaustion, is usually a sign of mitochondrial dysfunction. And there's many reasons for that. Toxins is a big component of it. And then if a person's toxic, infections can become much more, they can gain access. They kind of take advantage of a poorly oxygenated cell. They kind of camp out. They create inflammation. They further cause dysfunction around the cell. And so then it's a vicious cycle. It just gets worse and worse. And
I was going to say, you have this vicious cycle that happens. That's this like toxicity, infection, inflammation, toxicity, and it just keeps going. And we become incredibly burdened. Our organs and how we exhibit is always unique and different for each person. But if for the average person that's saying, okay, that sounds a little bit like me these days. I'm toxic. I'm obviously inflamed. I'm having a hard time waking up in the morning at times or having energy throughout the day. Where would you recommend you start with someone? If they were to come to your practice, you run certain tests that everyone should do or certain questions they should be asking themselves?
So generally when we're seeing patients in the office, like we try to boil it down to like, try to get the symptom list, but I try to get people focused on their top 3 symptoms. And quite regularly, people's top 3 symptoms are fatigue, brain fog, chronic digestive issues. Yep. So definitely our goal is trying to work on helping to improve the digestive function, because that is the exhaust system. That's how toxins leave our body in the most efficient way. But when there's too many toxins, and then if a person is getting inflamed, that also puts the body into fight or flight, which also then shuts down the normal digestive processes. Remember, you can't be in fight or flight and digest and rest at the same time. So that means I'm not making enough stomach acid. Parasites from the environment can easily gain entry. Again, it sounds overwhelming, but the point is, generally we start with helping to improve a person's normal digestive process and making sure there's enough good bacteria, there's no bad things in there like parasites or SIBO, bacterial overgrowth, and making sure we get rid of any food sensitivities temporarily. So like like a detox diet is usually where I'll start with, and it's anti-inflammatory, and it helps establish a foundation, because basically we're building blocks that we are constantly trying to help elevate a person's health from. Foundation is just so important. Sometimes it's not easy to get there easily. Sometimes it's very efficient. It really depends on a person's constitution. And, because there's so many issues, I find that one of the most challenging group of patients that we have are not only the ones that are fatigue, brain fog, and digestive issues, but also there's some kind of emotional component to this. And hence, that's why I bring up what we talked about earlier, what's happened over the last 3 years. But there's been a tremendous amount of emotional stress that has been inflicted upon every single American because of the constant, nonstop, pessimistic mass media, information, no matter whether it's in the newspaper or online or through social media. It's really difficult to avoid it. Even for the most astute, I know you probably are as about as good as they get, but you can't easily ignore it. So stress is stress.
It's almost impossible to ignore it. You could do your best, use the techniques that you may have acquired to combat it in many ways. But I know personally, speaking with my father and the clinical team at our clinic, that a number of patients are coming in with fear and confusion. And how do you go about that? And are you seeing the same? Because yes, the last 3 years were quite unique. And yes, a little bit fear-inducing and a lot of different information or misinformation, you could say, out there. So are you seeing that as well? And what are you doing to try and get patients out of that? Because then you have sympathetic nervous system overactivation. You have, again, vicious disease cycle that comes through the PNEI system into a biochemical cascade that is never going to help with treatment as long as they're stuck in those places.
I think that what you are seeing and your father's seeing at your office is the same thing that we're seeing at ours. And our approach is, number one, at least acknowledge it so that a patient can start beginning to unravel this web of uncertainty. We want to establish some facts around optimal health and goal setting. Not just goal setting for the person's health, but also what a person needs to be shooting for their own personal goals. Like now, I realize that in order for me to be well, I need to acknowledge and work on some of the post-traumatic stresses that have built up because of the massive fear that has been instilled in people over the last 3 years. And I think it's really, certainly not in our generation have we ever seen anything like this. Maybe there were times like this in the past before our generations, but there's always, the American way has always been about freedom and hope and equality. And there's so much confusion about what that means now. Yeah. So I try to at least get people back to their foundations. If a person has some foundation in their religious institution or a spiritual following, I strongly recommend get back to those basics, because the teachings from those great people have established some simple truths that we should be good to each other, that we should not that we should not steal, we shouldn't want, it's basically basics. I say 10 commandments. I hate to get to that level, but just start with basics. And then there are real post-traumatic stresses where now people get triggered by hearing things or seeing things into a fight or flight response. When fight or flight is so dangerous for detoxification, because the body can only detoxify in a rest and relaxed state. So we're talking about sympathetic nervous system versus parasympathetic. And is it any wonder when everybody's been in fight or flight for the last 3 years, our nervous systems have been ignoring our normal detoxification pathways because we've been in fight or flight. And so if we can get the nervous system calmed down with any technique, whether it's breathing or meditation or Wim Hof or New Calm or working with a Reiki practitioner or emotional freedom technique. There's so many great techniques, but a person needs to find what's right for them. We try to help them to identify it and then work through that process of unraveling it. It can be quite insidious and quite illness producing if it's not addressed.
Yeah, this is why I really appreciate your book, because cleanse your body, but clear your mind. You have to do both. And too many people, I believe, focus on the body, which we know this for certain, almost in a sense of everything is very visual. We want to look great. We want to get in shape. We want to do all these things, but we don't really focus on that mental aspect, the emotional aspect of everything. We overlook that. And when you're talking about detoxification, you can't have one without the other, precisely for what you just said. Sympathetic nervous system overactivation will not allow it. Yes. So you have to work on that. And that I really did appreciate your book and how you go into all those pieces you just mentioned with clear your mind. But I know there's a lot of focus also on genetics, on our predispositions. And sometimes we use that as a crutch sometimes. But I even recently spoke with Dr. Rao, and he mentioned 40% of his American cancer patients, they find a genetic deficiency in detoxification. They simply can't detox. What are your thoughts on the genetic predispositions of detoxification, and how do you work around that?
So I'm glad you brought that up. And I know Dr. Rao has been looking at that for some time. And only recently, like within the past year, have I also been really focusing on the nutritional component or the genetic component of this. There is a company that we've been using recently because I feel like their nutrition platform, their genetic platform really explains things in such a clear way. And I'll just mention that what I currently like is called Nutrition Genome, which people can order for themselves, but it's challenging for an individual to interpret it at the level that we need. So definitely there are genetics that absolutely have an influence on not just the detoxification. I mean, yes, the beauty is that it shows us phase 1 and phase 2 liver detoxification through cytochrome P450 genes, and then also like glutathione, peroxidase, acetylation, all the phase 2 liver detox pathways. And so getting the genetics can make a big difference, but also the neurotransmitter genetics is very interesting, specifically like the catecholomethyltransferase, COMT, and the serotonin transport pathways. They literally show how a person is potentially going to be more susceptible to going into fight or flight with the same exact circumstances. And when we've been reviewing these genetics with patients, there's like, when we go through it, they're like, wow, that really is me. How did you know that I've always had IBS? How did you know that I'm so susceptible to anxiety? And it has to do with sometimes people are like this, have slow COMT, so they are more susceptible to building up dopamine, which is then an excitatory neurotransmitter. And then we have to do things to try to help counterbalance that through the things that we would typically be saying, like meditation and exercise. But magnesium is really good for calming this. And lithium orotate can be really useful as a way to ground the nervous system. Yeah.
Yeah, there's so much to be said about our predispositions or, proclivities to certain things, but there's also epigenetics and, how we live our life. What are your recommendations then? You talked a little bit about diet. Let's go into that, maybe start there. Is there a specific detox diet that you're recommending for most people without getting into the personalization of it?
Well, I'll make a shameless plug for the book, which basically has the whole diet laid out, which is basically an elimination diet.
Yeah.
And the elimination diet, I think, is not anything new. It's just how we package it. But essentially, we are trying to temporarily eliminate inflammatory foods, which I say are, depending on what a person's level of inflammation is, we'll temporarily avoid grains, beans, dairy, nightshade vegetables, and basically processed foods. So what do you eat? Lean protein, chicken, fish, turkey, eggs, lots of vegetables, ideally organic if possible. Starchy vegetables are okay as well, like squash, sweet potato, pumpkin. And then if a person is concerned about weight loss, then there are some grains that might be okay, like millet or white rice, potentially. And the whole purpose is basically just taking a temporary modification to what a person's currently doing to allow the body to have a rest so it can refocus its efforts. And sometimes even when we have a patient that's very sick, we may even have them take a temporary fast. And fasting is age old. It's been around for thousands of years, built into religious holidays. And fasting is not just for spiritual intuition, but it's literally causes the cells in our body to have an opportunity to do its internal detoxification, which is called autophagy.
It's interesting you bring that up. I was recently speaking with someone about, I believe it was Dr. Gundry, who brought up fasting and to beware sometimes of heavy metals. I'm a big fan of fasting as well, but I'm also aware that if you're too toxic, sometimes fasting can release things. Your organs of elimination aren't primed to then get them out, and they recirculate, almost like a chelating before stimulating the organs can have a detrimental. What are your thoughts on that? Do you think that as you're fasting, you're improving the organs of elimination enough that they should be able to handle something like heavy metals?
Yeah, I think I might have a little bit of a different perspective than him. I'm not talking about like a month-long fast. But clearly, people need to have enough amino acid building blocks to be able to drive phase 2 liver detoxification. But I'm specifically talking about like a 1 to 3 day water fast, which is the purpose is basically to actually give the body a break.
Right.
And not much detoxification is going to happen in this time, aside from the lymphatic system can start working properly. And then we can start reintroducing with either bone broths or vegetable broths to basically start to rebuild a person's, because we're talking about very sick illnesses. And those cases do require some very unique processes. And then there's also like quite good detoxification supports, like, whether a person does Epsom salt baths or doing sauna is a great way to then allow the skin to have a greater role in the detoxification process. Even colonics I've found quite useful when people are in acute states of toxicity.
Yes.
So time and place, it is important. I'm sure Gundry is super bright. But I would just say I wouldn't ignore the benefits.
Oh, no. And again, like you said, it's something we've used throughout civilization as a way to benefit us. Fasting really is that reset button in many ways. And unfortunately, we don't reset at all. We're constantly throwing things within us that burden us. And when do we ever stop to say, okay, allow the body to reset? So I believe fasting is incredibly important.
Well, and also, I guess since we're talking about fasting, it's also worth talking about taking a fast from electronics.
Oh, yeah.
Because EMFs are quite aggravating to our nervous system. It also will put our nervous system into the fight or flight response. We at my home, we just did like an EMF detection just to double check to see, because it's impossible to live in New York City without getting exposed to Wi-Fi and EMFs. But if it's too high in certain places, it can be quite detrimental, especially for kids. And I have a 4 and a 6-year-old at home. So we found that on where our bed is sitting happens to be on the other side of the wall from where our Sonos is sitting. And so we found that there was enough radiation coming from that. It's electricity. And that's not something that you want your baby brains to be getting exposed to at night. So people can easily buy these EMF detectors online. They're not expensive. And people like it's basically appliances or things to watch out for, like refrigerators, microwaves, but also TVs and Sonos.
And Sonos, of course. Yeah, we're not doing any justice for Sonos sales here, but no, it's very true that, listen, we live in an electric soup of things. EMF, we have 5G, we have Wi-Fi, we have all these things. We have to limit it, especially as we sleep. We need a harmonized environment for a harmonized body and mind. And so I'm glad you brought that up, because most people don't see EMF as a toxin. They're not getting the lab results of their EMF exposure, right? Even though it's there, and it can absolutely be seen in HRV and sleep things and like that. Now, let's get into a little bit of drainage now, because there is a difference: detoxification, drainage, lymphatic drainage. Do you put many patients on drainage remedies, or is that something you're doing on a case-by-case evaluation?
So important.
So important, right?
It's almost like you have to have that with whatever detoxification process you're doing. The question is what's the right one for each individual? If the liver and kidney is not prepared to manage the toxins that are being released, we have to be really gentle with lymphatic drainage. And hence, that's why also we want to generally make sure that the colon is working regularly. But if that's all intact, then there's great spagyric homeopathic remedies for drainage remedies, like the Bacana kits. We used to use the Saluna when it was available in the United States. And then also there's great herbs that are good for this. We've been using products recently from either Cellcore has some good products for this. And but you know what works great? A lymphatic drainage practitioner. Yeah. Like the good old-fashioned lymphatic drainage, that's where I've seen people really that are stuck make huge differences for like chronic sinus infections, chronic sore throats, just manually draining the area. Usually like 2 or 3 sessions, it really opens that up. And then also for like chronic lower extremity edema or swelling, lymphatic drainage practitioners can't beat it for an effective way of managing the lymphatic system.
I feel like it's the most overlooked part of this whole idea of detoxification is drainage, and especially the lymph, right? Because there's so much stagnation going on. We know all about, the liver and, urinating it out and everything, but we always forget about the lymph. It's just this unheralded hero of detoxification that we somehow forget.
I'm thrilled that you brought it up. You made sure that we talked about it, because people don't realize that there is another circulatory system outside of our blood vessels. So in addition to arteries and veins, there's a tremendous interconnected network that's called the lymphatic system, and they are connected by lymph nodes, which basically means that our immune system is pretty interconnected with the lymphatic system. So if our lymphatics are congested, our immune system is backed up. So when people start noticing like those little lymph nodes that are starting to not go down, or like lipomas or cellulite, those are all signs that the lymphatic system is congested. It's in American medicine, it's like completely overlooked, except in like unusual circumstances. And in the United States, people just don't ever talk about it, but it's quite common to talk about in other types of healing systems. So people should know the word lymphatics and lymphatic drainage, and the signs of it are swollen lymph nodes, lipomas, things like that.
Right. And there's such simple ways. Of course, going to a lymphatic drainage specialist is one way, doing cupping, or we have matrix regeneration therapy, which is like modern cupping. But, even jumping on a rebound trampoline is good for that. Just getting that movement going. I mean, listen, just moving is good for it, right? Too many people are just sitting here like myself for hours upon hours. And that is stagnation, right? That lymph is not moving. Just get up, shake it out, right? Shaking your body even is a good way to get it going. So it doesn't have to be anything too technical. It's just literally movement.
Great point, Casper. Movement is actually, every single time the muscle contracts, that's pumping in the lymphatic system.
Right.
So that's a great argument to make sure that a person's either going to the gym or even walking in the park, but with a vigorous pace. And that is lymphatic drainage. And that's why, hence part of the reason why people feel so good when they're done with exercising.
Absolutely. Now, you have yourself a daily benefit program. Can you go into that, what that entails?
Thank you for asking. It's something we've been doing for probably almost 20 years at this point. But essentially what we use is a hypoallergenic rice-based protein shake.
Mm-hmm.
And it just has a non-allergenic protein source with certain vitamins and amino acids that are for supporting phase 1 and phase 2 liver detoxification. We add glutamine powder to that, which basically helps to keep blood sugar stable. And then a fiber, which is just to help make sure that a person's having regular bowel movements. And the fiber also is very good for binding onto many different types of toxins.
Right.
Generally, we'll recommend that a person have that for breakfast. And then they could do it again, like a shake and a salad for lunch, and then protein and vegetables for dinner. And that's like a very simple detox for that almost everybody could benefit from doing, like for 2 weeks or 4 weeks. But sometimes people really like it and they stay on longer, and that's okay too. It's good.
Of course. And are you a proponent of always detoxing around the spring and fall times, the changes there? That's kind of a Eastern medicine approach to it. I think Ayurveda also is during those times, that's when it detox. But what do you feel about that?
I love seasonal detox.
Yeah.
Yes. There is something to it. Just like the flowers are coming out of the ground in the spring, and that's the time for plant renewal. Our bodies are also going through a similar type of process where we are producing restorative hormones. So it's so good to take advantage of the spring, summer, fall as times for different types of detoxification. But the spring, it is coming up, and we're all getting ramped up and ready for our spring detox, which is fun.
I'm getting ready, but I was expecting spring, and it's snowing in New York, as you know. And I think this is our first real snow, and this made me step back away from spring. Yesterday, I was watching those flowers bloom. Now they're covered in snow. So maybe a few more weeks before I start my spring detox.
Yeah. It's okay. It'll get here. We know it'll get here. We're all looking forward to it.
Oh, definitely. And you know what I'm looking forward to? When's the next book, Dr. Morrison? You got to let us know.
That's very great question. I am very happy and proud of my first one. And right now, I just love taking care of patients. So I just want to spend my time doing that and taking care of my family. Those are my priorities.
Those are good priorities to have, healthy priorities to have. It's never easy to write a book. And that first one was so great. So definitely check that out. Where can people learn more about you and the practice?
Please visit our website at morrisonhealth.com. I would also encourage any doctor or nurse practitioner or physician assistant or naturopath or any kind of practitioner to consider looking at the American Academy of Environmental Medicine as a resource for learning about detoxification. I'm on their board of directors, so I do have an interest. It is not a paid position. It's just, I love environmental medicine. Mm-hmm. I really want to see as many practitioners there as there can be to be informed about detoxification for their patients, for themselves, for their families. And AAEM, the American Academy of Environmental Medicine, is the place to do it. And we are going to have a November conference in 2023 in San Antonio, Texas, in person, which is
first one in a while, huh? They're coming back, right? I'm heading out West Coast this weekend to go to a conference that hasn't been around for a while. So it's fun to see those back. And you bring up a really good point, because a lot of people ask me, oh, I can't make it in New York. How can I find a doctor that understands what we talk about a lot? Are there other resources you would say, aside from the AEM, that you could point people in that direction?
Well, definitely start out on their website, because they do have a doctor search.
Okay.
And probably also the American College for the Advancement of Medicine, I think, is also very good. ACAM is a great resource for doctor searching for like-minded doctors.
Yep.
Because we're all basically doing integrative medicine at this point, which I would say functional medicine is a piece of integrative medicine. Mm-hmm. And usually doctors that are doing what we're doing are doing a little bit more broad approach.
Yeah, no, completely agree. Well, Dr. Morrison, thank you so much for joining us, sharing your knowledge, and really appreciate everything you had to say here today.
Thanks, Casper. It's always a pleasure. It's great.
Remember, just because we live in a toxic world doesn't mean we have to be toxic ourselves. Check out Dr. Morrison's book, To Live a Clean and Clear Life, and be sure to visit his website, morrisonhealth.com. Until next time, keep writing your own healing story.